So, how does a nation actually build a healthier, more prosperous future for its people? Well, for Nepal, a huge part of the answer lies in its long-standing commitment to family planning. We're going to break down their really ambitious blueprint for what comes next. And this right here, this isn't just some generic mission statement. This is the powerful vision that's driving every single part of Nepal's national strategy. It puts health, happiness, and, crucially, individual rights right at the center of everything. It's a really inspiring goal for the end of the decade. Okay, so when we say family planning, what are we really talking about? It's not just about, handing out contraceptives. At its absolute core, it's about empowerment. It's about giving people the knowledge and the tools to make some of the most fundamental decisions about their own lives. And here's what's so fascinating about Nepal's approach. This isn't just a public health program, it's a fundamental constitutional right that takes family planning from being just a service you can get to a guaranteed freedom for every single citizen. That's a huge deal. Now, a commitment like this doesn't just pop up out of nowhere. It's been built up piece by piece over decades. So let's take a quick look back and see how this whole thing evolved into the major national program it is today. The whole story starts way back in 1959 with a non-governmental organization. Then, by 1968, the government realizes how important this is and jumps in with its own national program. Fast forward to 94, Nepal gets in sync with global development goals. And then, in 2015, they launch the modern strategy we see today, a comprehensive, fully costed plan. You can really see that journey from a grassroots idea to a top national priority. Okay, so that's the history, but how does a grand strategy like this actually work day to day? How does it translate into real services for real people? Let's get into the blueprint for making it all happen. The whole strategy is built on 5 key pillars. First, you protect it as a right. Then you create demand for the services. And, maybe most importantly, you deliver those services to everyone, especially folks in rural areas or adolescents who are often left out. And all of that is backed up by training healthcare workers and constantly using data to see what's working and what's not. It's a really smart 360-degree approach. So, what does this actually look like for a person living in Nepal? Well, it means things like satellite clinics in remote mountain villages. It means access to a whole range of modern methods, from long-acting options like implants to newer things like the Ciana Press injection. It also means emergency contraception is available everywhere, and they're even teaming up with the private sector to reach more people. The key takeaway here is that it's all about making sure these services are not just available, but truly, genuinely accessible to everyone. Of course, a great plan is useless if you don't track your progress. So let's dive into the numbers that tell the story of where Nepal is right now and where it wants to go by 2030. First up, let's look at a really important number: the rate of modern contraceptive use. Basically, what percentage of women are using a modern method? In 2022, that was at 43%. The goal for 2030? A pretty ambitious 60%. If they hit that, it would be a massive step forward in empowering women across the country. At the same time, they're trying to solve the problem of unmet need. That's the gap: women who want to use family planning but for whatever reason can't access it. The goal here is just as bold. They want to slash this number by more than half, dropping it from 21% all the way down to 10%. And all of this work, all these targets, are driving toward one single really important number: 2.1. That's the magic number for the total fertility rate. It's the replacement rate, where a population becomes stable. Why does that matter so much? Well, a stable population is the bedrock for sustainable economic growth, less strain on schools and hospitals. Basically, it's the key to long-term national prosperity. It's the demographic sweet spot. But let's be real, no plan this ambitious is ever a straight line to success. It's time for a reality check, because there are some pretty big hurdles standing in the way of these goals. You've kind of got this tug of war happening. On one side, you have these incredible strengths: strong government willpower, free services, great partnerships. Awesome. But on the other side, you're dealing with some serious threats. Budgets are shrinking, there are delays in getting supplies, and you still have cultural and religious pushback. It's a real battle between progress and pressure. So, how are they fighting back? Well, to deal with those threats, Nepal has made some very specific public commitments. They're directly targeting their weaknesses. They're working to strengthen how things are run, making sure supplies are always available, tailoring services for young people, and, this is the big one, committing to actually increase the budget over time.
This is their game plan for tackling those challenges head on.
So, we've seen the incredible vision, the detailed plan, and the very real challenges. There is no question that the commitment from Nepal is there, but it all boils down to this. With money getting tighter and cultural barriers still in place, can that strong commitment be enough to turn these ambitious goals into a reality for every single person by 2030? That's the multi-million-dollar question, isn't it?